Did you know that laser treatments can actually cause dark spots instead of removing them, especially in darker skin tones? Laser treatments are widely used for skin rejuvenation, pigmentation, and acne. But in patients with darker skin tones, laser procedures can sometimes trigger a condition called post-inflammatory hyperpigmentation, or PIH. This means the skin becomes darker after the treatment instead of clearer. Why darker skin is more vulnerable? People with darker skin types, Fitzpatrick, 4V, and VSI, naturally have more active melanocytes. Melanocytes are the cells responsible for producing melanin, the pigment that gives skin its color. When the skin experiences heat or inflammation, these cells respond by producing even more melanin. Laser treatments work by delivering thermal energy into the skin. This heat can trigger an inflammatory cascade that stimulates melanocytes and leads to excess pigment production. What happens inside the skin? After laser exposure, the skin releases inflammatory mediators such as prostaglandins, leukotrienes, and cytokines. These molecules stimulate the enzyme tyrosinase, which increases melanin synthesis. The pigment is then transferred to keratinocytes and appears on the skin as dark patches or uneven pigmentation. Carbon laser treatment, Hollywood peel. Many clinics promote carbon laser as a gentle treatment safe for all skin types. The procedure involves applying a layer of liquid carbon on the skin. The carbon penetrates the pores. A Q-switched end-YAG laser targets the carbon particles, and the particles explode, exfoliating the skin and removing debris. Although it is considered less aggressive than ablative lasers, carbon laser still delivers heat into the skin. In darker skin types, excessive heat or high energy settings can still trigger post-inflammatory hyperpigmentation. Several dermatology studies have reported that pigmentary complications remain one of the most common risks when lasers are used in darker phototypes. Risk factors for hyperpigmentation after laser. The risk increases when high laser energy is used. The skin is not properly prepared before treatment. There is excessive inflammation after the procedure. The patient is exposed to sun without protection, or the patient already has conditions like melasma. Prevention strategies. To reduce the risk of pigmentation in darker skin, dermatologists often recommend pre-treatment skin preparation using depigmenting agents, lower energy settings, multiple gentle sessions instead of aggressive treatment, and strict sun protection with broad-spectrum SPF 50. Closing message. Laser treatments can be very effective, but they must be used carefully in darker skin types. The safest approach is always proper skin assessment, appropriate laser selection, and experienced medical supervision.